Okay. Good day. So I would love to ask a few questions. Can you explain the term AMR?
So AMR is an acronym for antimicrobial resistance. This week, the global community uh, is also marking AMR Day, and the purpose of marking it is to create awareness, educate the populace, and also advocate for actions, all possible actions, among the key stakeholders to tackle the problem of AMR. AMR has become a serious public health problem of global concern because deaths arising from infection has been escalated by it, up to about 700,000 additional deaths. And the speculation is that by 2050, if AMR is not arrested, we will have this amounting to up to 10 million. And this is the problem with it. AMR comes into place as a result of abuse of antibiotics. Abuse by humans themselves, especially those that have ailments that don't need antibiotics, and they will have to go to the chemist shop to buy antibiotics for an ailment that does not need antibiotics. The consequence is drug pressure on the bacteria they are carrying, either as especially those bacteria that colonize their body, different parts of their body. They put them under unnecessary pressure and transform them genetically to become an antimicrobial resistant one. A farmer, especially those into poultry, those into fishing, they normally use antibiotics as a growth enhancing drug and also to protect them from infection. While not infected, they are giving them antibiotics, and the consequence is pressure on the bacteria that colonize them, and those bacteria also become antimicrobial resistant. The problem is this: especially in an area where hygiene and sanitation are poor, and also water supply is substandard, there is high likelihood to have antimicrobial resistant bacteria from the environment getting into humans, and in the humans in the community getting into the hospital. So many outbreaks have occurred as a result of that people don't know that are silent. But what is more concerning is that in the hospital, patients tend to spend longer days in the hospital, and some of them will not make it because all the antibiotics they will give them will not work, or because of the high cost of treatment, they will request for discharge against medical advice because they will not be able to pay for more treatment. We are saying this because of the cost implication and making antibiotics to become inconsistent in terms of cost effectiveness. So with this education, the government, the non-governmental organization, civil service organization, international bodies can come together and act against AMR. And acting against AMR, there are many channels that the action can touch. At the level of chemists, need to monitor sales of antibiotics and also educate pet medicine vendors on the issue. Among the fish farmers, poultry farmers, and those in the abattoir, it's also important for them to know the damage AMR is causing, that this damage will become worse if they don't stop the practice of giving antibiotics to their fish, to their birds, to their cattle, to enhance their growth, because they are substitute growth as enhancer, and many are keeping their environment clean, having good sanitation and access to good water supply. They will not have dead animals at the end of the day, and they will be able to make profits from their farming. Government, on the other hand, should try as much as possible to meet the target set for WASH, which is water, sanitation and hygiene, so that we have up to more than